Hi guys, it's Lauren Diffendover here, the medical educator for the DIS Foundation, and today we're going to talk about items you should put in your first aid kit and bust a few first aid myths. It's always a good idea to have a first aid kit handy for a medical emergency. Consider purchasing a commercially available first aid kit or making your own. Having one available around the house, in your car, and at your work is essential. Common items found in a first aid kit include bandages, roller bandages and tape, sterile gauze, antiseptic wipes and swabs, absorbent compresses, antibiotic creams, burn ointment, mask for rescue breathing, chemical cold packs and/or heat packs, eye shield and eye wash, a first aid reference guide with local phone numbers to emergency contacts, and personal protective equipment. Now, again, let's also discuss some common first aid myths and the treatment process you should follow in a case of an emergency. So, one first aid myth that you can is that you can rub oil, grease, or butter on a burn to treat it. However, please do not do that. Rather, you should ensure the source has been dealt with and the scene is safe. Wear personal protective equipment and retrieve a first aid kit. Rinse the burn in cool or cold water. Apply antibiotic or burn cream. Be sure there's no allergy exists before you do that, however. And then cover with a clean dressing. Another first aid myth is that you should tilt the head back or put the head between the knees during a nosebleed. But again, do not do this. Rather, you should put on protective gloves and pinch both sides of the nostrils below the bony portion for 5 to 10 minutes and keep holding for an additional 10 minutes if the bleeding continues. However, if it does not stop or there's trouble breathing or signs of distress, go ahead and seek medical care. Don't forget, online CPR certification is available on our site. You can find a link in the description. We encourage you to become certified as soon as possible, either in a classroom or on your own time with an online course. So, thank you so much for tuning into today's webinar, and we will catch you next time.